Okay, so let's talk about it. Okay, Lyme disease. Well, as I was saying, living in the Northeast, I think most everybody's kind of familiar with Lyme disease, but really some people may not be aware exactly what it is. They know that it is something that you get from ticks. So Lyme disease is caused by a bacteria that ticks carry. And let's see, go through this. Borrelia burgdorferi is the bacteria. And anyway, that is the bacteria that the ticks carry that can make you sick with Lyme disease. It was first recognized in Connecticut in 1975 when a whole bunch of kids got sick and they were diagnosed with juvenile arthritis. And this was in Lyme, Connecticut, and other two neighboring towns. But researchers found that the bites were from infected deer ticks, and they were responsible for the outbreak of arthritis. I grew up in Kansas, and I never heard of Lyme disease. And so, but everybody was always talking about Lyme disease. And it wasn't until I moved to California that I heard about ticks and Lyme disease. Apparently, California has a lot of ticks and a lot of Lyme disease too. Okay. And the ticks carry the bacteria, live throughout the United States, but Lyme disease is most common in the Midwest, upper Midwest, the Northeast, and the Mid-Atlantic states. It's also common in Europe and South and Central Canada. And you're at risk of getting Lyme disease if you spend any time outside, such as in grassy areas, bushy or wooded areas. And taking safety measures in these, if you're going to be out there, can help lower your risk of getting Lyme disease. And even just going outside in your yard, mowing your grass, doing gardening, you can get ticks. Ticks are everywhere, especially in the Northeast here. In general, ticks are approximately the size of a sesame seed, and the nymphal ticks are approximately the size of a poppy seed. And that is why sometimes people get bit by ticks and they don't even know it. They can't see it. It could be in a fold of the skin, it could be in your hair, neck, you name it. But anyway, here's just a comparison with a dime that shows the different size of the tick, the adult female, adult male, nymph, and the little larvae. This year I had been outside, and so I went and I took a shower, and I was, scrubbing myself down, and I saw a little piece of dark little mark on my leg. I thought, oh, so I took the soap and washed it off. It didn't come off. It didn't come off. It's like, darn it, that was a tick. So anyway, I was able to remove it right away and had no further symptoms. And again, here are some close-up pictures of what we're talking about. Lovely. And this is in size to your finger. You see how little they are. The little ones are usually the ones that do a lot of the biting. And then we have the Lyme disease symptoms. And these are the early signs from 3 to 30 days after being bit. If you get bit by a tick and remove the tick within 24 hours, chances are you will not develop Lyme disease. But still, the tick needs to be removed and you need to watch yourself. Because according to the CDC, they say that you can still develop Lyme even if it's been less than 24 hours. So you just want to watch, but the likelihood is much lower. So the first signs that you're going to see is going to be fever, headache, sometimes, irregular heartbeat. You're always going to have fatigue, sometimes dizziness, and then the bullseye's rash will appear, or any other kind of rash. But fatigue, headache, and fever are the first two commonly signs of you may be experiencing Lyme disease. And then again, early symptoms: fever, chills, headache, fatigue, muscle and joint pain, swollen lymph nodes that can be around your neck, under your arms, in your groin area, and that may occur in the absence of a rash. You don't always have to have a rash. The rash is called erythema migrans, or EM, and you can see the picture of what a rash may look like. And it occurs in approximately to 70 to 80% of the people. So that means that not everybody who has Lyme disease will have a rash. Not everybody. And the rash usually begins at the site of where the tick bit you. And it, let's see, yeah, it usually occurs in about 7 days, sometimes sooner, sometimes later. And then it will gradually get bigger and bigger. And it may feel warm to the touch, and you may not be aware that that's what the rash is about, but you have something that's on your skin, doesn't look right, you don't feel well, maybe Lyme disease. And let's see, sometimes it clears as it enlarges, resulting in the target or the bullseye appearance. And again, the rash can appear anywhere on the body. And it does not always appear as the classic rash, the bullseye rash. Later symptoms, that goes from days to months after a tick bite. You may experience severe headache and neck stiffness, additional rashes on other areas of the body. You can also have facial palsy, which means a loss of the muscle tone and the drooping of the face. That can be a sign. And arthritis and other severe joint pain and swelling may occur in the larger joints, along with your fingers. And you may have intermittent pain in tendons, muscles, joints, and bones. And this, again, is in later stages of the disease. Heart palpitations and irregular heartbeat may develop, and this is called Lyme carditis. And if untreated, you can end up with damaged heart. So this is something that you don't want to take lightly. You want to be treated. Have episodes of dizziness and shortness of breath, and inflammation of the brain and spinal cord. I was telling Sue earlier that one of my girlfriends, who is also a nurse, she runs a horse sanctuary, rescue. And her daughters came home one day, and they found her that she was really, really sick, and she was disoriented. And I mean, she was not right. So they took her right into the hospital. And anyway, after much screening and many tests, they diagnosed her with Lyme disease encephalitis, which is the inflammation of the brain, or she had a really bad brain infection. And it's taken her about 2 years to get recovered, to fully recovered. And she's about, probably 98% now. And it's been well over 2 years. So, I mean, this can have a pretty devastating effect. And you can have nerve pain, shooting pains, numbness, or tingling of the hands and feet. And again, these are all later signs and symptoms of Lyme. And here we have what your classic Lyme disease rash is going to look like, which you can see that it looks like a target or a bullseye. Here's another one, which is how it could look. It could bluish hued without central clearing appearance. And then we have the circular rash with central clearing that just doesn't have it bullseye, but it does have that round rash. And then we have the red-blue lesion that can be on the back of the legs, the elbows, you name it. It can be anywhere also. So it just kind of shows you that not all of the rashes are going to look the same, but it will be a rash. And what are the stages or phases of Lyme disease? And the Lyme disease may develop over different phases and overlaps and cause symptoms that involve the heart or the nervous system. And let's see, early localization of Lyme disease is usually 1 to 4 weeks. Early disseminated Lyme disease is month 1 through 4, and then late and persistent, late disseminated, or just late Lyme disease is after 4 months and even up to a year. So there's different categories of Lyme there. And how is Lyme disease diagnosed? And what you do is you go to your healthcare provider if you're feeling, a headache, a fever, aches and pains, and, your rash. So you go there and you're going to have the physical symptoms. And especially if you live in an area you've been outside and have possibly had contact with ticks. And many people don't even remember or know that they've been bitten by a tick because it's so tiny and it's almost always painless. So you don't know. Your provider your doctor will confirm the diagnosis with a blood test. And so they will take your blood and do a test for Lyme disease. If it's negative, then you don't have Lyme disease, you have something else going on. But if the first test proves to be positive, then they will run another test using the same blood so you don't have to get stuck again. And then they'll test it in a different way and see if it's positive. If it's positive, again, 2 positives equals Lyme disease. And if only one is positive, it's something else going on. A few years ago, I had been sick for a couple of months and off with fever, headache, aches and pains. And then I finally went to the doctor, and my first test proved positive for Lyme disease. My second test was negative. And so anyway, they had diagnosed me with a strep infection. And so I had been started on antibiotics to cover both Lyme and strep in case that's what it was. And it did turn out to be strep. And Lyme disease is usually treated, it's always treated with doxycycline or amoxicillin, and they're both effective for Lyme disease and for other bacterial infections. And your treatment will depend on how long and what stage you are in the infection. In general, it's the sooner that you get treated, the quicker and more complete the recovery will be. And pregnant women should receive treatment for Lyme disease as well. And there's no evidence that a fetus can get the infection from its parent. So there's no strong evidence that miscarriage is more likely after Lyme disease also. And how can we prevent Lyme disease? Most people are infected when the ticks come out, and that would be late spring, summer, and early fall. And when people are out working in their yards, they're hiking, vacationing, doing all sorts of things. And that's when the little ticks are out feeding. In warm climates, there's few tick bites take place during the wintertime. Deer ticks are the most often found in wooded areas and grasslands, especially common in areas that merge like neighborhood yards and where deer may roam, which is part of Hershey because there's deer just about everywhere in Hershey these days. And so ticks are going to be there. But the good news is ticks don't survive long in the sunny areas, and they dry out quickly. So only about 1% of all deer ticks carry Lyme disease in areas in which over 50% carry the bacteria. The diseased ticks are often found in the upper Northeast and upper Midwest, and ticks can also live in the coastal regions. Black-legged ticks can get the infection from other animals other than deer. They can get it from mice, voles, and some of the squirrels carry bacteria, which is something I didn't know, didn't realize that. And how can I prevent ticks? Well, a lot of it is just good common sense. You want to repel ticks by spraying clothing with an insecticide, commonly found in your stores, and insect repellents that contain a chemical called DEET. can also be applied directly to your skin. Although it's kind of oily, there's a new one out, and actually I can't remember the name of it. It starts with a P, that is supposed to be just as effective as DEET, but not so oily and icky on the skin, and it doesn't stain your clothing. And so you want to read the labels carefully, and you don't want to overuse because too much could be harmful to your skin. You want to minimize skin exposure to both ticks and insect repellent by wearing long pants and shirts that fit tightly around the ankles and wrists. Wear a hat, tuck your pant legs into your socks, and wear shoes that are not open-toed, and don't leave your feet exposed. Wear light-colored clothing to make tick detection easier, because you'll see little specks and you'll be able to see the ticks easier. When you're out hiking, you can walk in the center of trails to avoid picking up ticks from overhanging grass, but that's not, it may or may not work. And after outdoor activities that you are in at risk picking up a tick, do a tick check and shower and scrubbing with a washcloth. Get rid of any ticks on your clothes by putting them in the dryer or the wash for 15 minutes, and this will kill ticks attached to the clothing by drying them out. And also, pets may bring ticks into your home if they are going outside. Dogs are notorious for having a lot of ticks, as are some of the cats. And there's ways to prevent ticks on your animals, and discuss that with the veterinarian. And they have, I think it's Revolution that they're recommending in this area now for your dogs and cats. Here's kind of a little fun fact. When I was discussing with the vet about my cat and having ticks, she had said that dogs can get Lyme disease, but cats don't. There's been no reported case of a cat ever getting Lyme disease. Good to know. But they can drop them on you. And then we have how to remove a tick. So you're going to, there's several ways, but this is the recommended way that the CDC recommends to remove a tick, in that you want to use fine tip tweezers, and you get the tick as close to the skin surface as possible, and then pull upward with steady, even pressure. You don't want to twist or jerk or anything like that, because what can happen is that the head can break off and remain in the skin. You don't want that. You don't want to squeeze the tick, because the tick has may have the bacteria in it, and by squeezing the tick, it will push it into your skin. You don't want that either. Let's see. If you cannot remove the head with tweezers, leave it alone and let the skin heal. And afterwards, you want to wash your skin where the bite was with soap and water or rubbing alcohol. And again, wash your hands. Number 4, you never crush a tick with your fingers, and dispose of a live tick by putting it in alcohol, placing it in a sealed bag or container, wrapping it tightly in tape, or my favorite, flushing it down the toilet. And here's an illustration on how to use the tick, how to remove the tick. Just take it, pull up and out, and then dispose of it. And Pastor Stephen showed me these cute little tick removers that you can put on a keychain. And so always have one. And you can buy them off Amazon. Oops. There. Buy them off Amazon. They're about $3 a piece. And here shows you how to use the tick remover tool. That you have the tick, get it in the little, narrow area, then you just pull straight out. And so, when should you see your healthcare provider? You should go to your provider if you're feeling sick after spending time in areas where the ticks might live, and you should see them. And if you do have a tick diagnosis and you've taken all of your antibiotics, you still want to contact your provider. And this is especially true if you have any symptoms like a stiff neck or mental confusion, like I told you about my friend Beth. And what is the outlook for somebody with Lyme disease? For most people who get treatment right away, they will be fine. And treatment can cure Lyme disease, but you still may have some long-term side effects. All untreated, Lyme disease may contribute to other serious problems, but it's rarely fatal. It'd just be uncomfortable. In chronic. And then post-treatment Lyme disease syndrome. And even after proper treatment, some people, 5 to 15% of people may experience lingering fatigue, achiness, or headaches, and this is known as post-treatment Lyme disease syndrome. The symptoms don't mean that you still have the infection. It just means you still have the residual side effect or the residual symptoms. And it probably won't respond to additional antibiotics. And the majority of people in this group will have symptoms that resolve at some point over 6 months. In chronic Lyme disease, I don't know if any of you've heard about chronic Lyme disease, but it is a term used for people who have had the condition and the symptoms of the long-term Lyme disease syndrome or symptoms. And let's see, however, some people receive chronic Lyme disease diagnosis without a Lyme disease diagnosis. Sometimes extended treatment with antibiotics will help. And this term is why some people think a Lyme disease infection can occur without being bitten by a tick. There isn't enough proof that mosquitoes can transmit Lyme. And many researchers dislike the term chronic Lyme. So key points to remember. Most Lyme disease tests are designed to detect antibodies made by the body in response to infection. And antibodies can take several weeks to develop, so patients may test negative if infected only recently. Antibodies normally persist in the blood for months or even years after the infection is gone, so therefore you can't take a blood test to find out if you're cured. You have to go by your symptoms. Infection with other diseases, including some tick-borne diseases or some viral, bacterial, or autoimmune diseases, can result in a false positive test. So if you have, some other illness or condition that's going on, you could get a false positive, and that's why they usually do the 2 tests. And some tests give results for 2 types of antibodies, IgM and IgG. And positive IgM tests should be disregarded if the patient has been ill for more than 30 days, but that's a little bit too much information right there. So anyway, that's about covers it for right now. And I thank you all for coming. And
now wait, don't run away.
I'm not going to. And stay safe.
Okay.
Okay, so I'm going to stop I'm going to stop sharing, and I'm going to stop the recording for right now, and then I'll take questions. All right?
Okay.
Okay.